Given the fact that we are having a lockdown, it is not surprising that a lot of us are having psychological and behavioral problems associated with it. Considering that a lot of us might be having kids or other people in our family who might be having special issues, it's going to be even more difficult for us to cope. I'm going to spend a little time about talking to you all related to having a child who might be having the autism spectrum disorder in the family. Now, we all know that kids with the autism spectrum disorder or even adults with the autism spectrum disorder need to have the sameness of routine. That gives them a feeling of reassurance, that makes them feel a little more comfortable, that seems to reduce a lot of the anxiety that otherwise would be manifest in various behavioral issues. So what happens if a kid with ASD who's used to having a routine, who's used to going for a walk at a particular time every day, who might be used to going to a workshop or a school where his needs are met with, where he meets teachers who know how to cope with whatever be the behavioral issues, what happens when suddenly all of that stops? What happens when, in addition to everything else, he might be asked to wear a mask if he goes out? He has to wash his hands over and over again in order to prevent from any calamity happening to him. It's not easy. And what happens to parents when they have to cope with this, or the caregiver when they have to cope with this? What happens when the caregiver who might come in and look after the kid or the adult for a while suddenly cannot make it? Not because he doesn't want to, but because there's no transport. The parent or the person at home then has to cope with this behavior through the day, and it certainly isn't easy. His meals may not happen at the right time every single day. He might have issues with sleep. He's used to interacting with certain amount of people. He's used to maybe doing a painting job or some machinery work or working at the computer, and suddenly all of that seems to stop. Is there a solution to all of this? There are no easy answers. But I'm just going to make a few comments that might actually make a difference. Supposing your child is used to being taken out at a particular time every single day, it might make sense for him anyway to wear the clothes that he would normally wear and to kind of make him go for a little walk within the flat. It's not easy, it's not the same thing, but sometimes just the physical activity makes a difference. Attempt to incorporate activities in the house that maybe he would be in a position to do over there if he was used to painting or if he was used to doing some computer work. And if you have some kind of facility of a similar nature at home, that is known to make a difference. See if there is a possibility of having a constant engagement with him and his friends over one of the iPhone or whatever groups that you might have. Use Periscope or Zoom or even some group chat so that he can see people who he's used to seeing. It might give him a sense of security. Ensure that there is a routine at home, even if all of this can't happen. He must get up at a time that he normally is used to. You must attempt to get him to sleep at a particular time. Try to be as regular as you can in this. But it's not the same thing. So he's going to get angry, he's going to get upset, he might scream, he might become aggressive. If he was already on medication, it might then make sense for you to get in touch with the psychiatrist that he was seeing in the past or the neurologist that he was seeing in the past and ensure that the medication dose is adequate. It might need to be topped up. And today, with the new guidelines for telemedicine, it is possible for a prescription to be sent to you by your own psychiatrist wherein medication doses might be adjusted provided the person has seen your son or daughter in the past. What do you do if there has never been a chance in the past or a need in the past for your child to have been on medication? If you feel that he's absolutely out of control, he's becoming very aggressive, either hitting somebody else or hitting himself, screaming, shouting, breaking things, it might then be necessary for you to take him to the closest hospital which has a psychiatrist. Take him to the emergency room because most OPDs might be shut, and ensure that some timely help of a medical variety is provided to him. Occasionally, in rare cases, if there's a necessity to admit him, that might also be indicated. All essential services, including hospitals, especially for mental psychological problems, are functioning. So if you feel that it is absolutely impossible for you to cope with whatever is happening with him at home, it would be perfectly in order for you to take him to the closest hospital or to your doctor and see if medication has to be changed, a new prescription has to be given, or if it is necessary for admission as well. We'd hope that this lockdown gets over soon. It's also going to have an effect on the caregiver. So for the parents or the other people in the family, ask for help. Mum should ask for the help of the father, father should ask for the help of the mother, the other peers of the child have to pitch in and help as much as is possible. This is not the time to be Superman or Superwoman. It is absolutely essential for everybody also to be consistent in the responses that they give to the person when he's having a particular symptom, when he's showing a particular inappropriate behavior. If he then knows what to expect when he behaves in a particular way, hopefully he will then respond in a way which is consistent and appropriate and will not cause a problem. Mums and dads and other caregivers have to have time for themselves. We don't want you to have a problem just in the process of coping with the young child who's having an issue. It is necessary also for you to take care of yourself. Do remember, this is not going to last forever. We have to survive these 2 or 3 or 4 weeks. Let's do the best we can. This too shall pass. Thank you.